2 little capsules of nitrate. Now, millions of people are already feeling the benefits of having more of it in their system. And get this, if you've got enough nitric oxide floating around, you might just be able to dodge a heart attack. Now, let's get serious for a second. We'll break down what happens when you're having a heart attack, what to do, and how hospitals treat it. But more importantly, we'll talk about prevention. Because let's face it, the best way to deal with a heart attack is to never have one in the first place. And I'll share my survival of my second heart attack. So you're having a heart attack, now what? See, first thing is first. If you think you're having a heart attack, call 911 immediately. Don't try to tough it out or drive yourself to the hospital as I did 10 years ago. Time is muscle, people. Every second counts. Now, let's talk about what happens when you get to the hospital. They're going to hit you with a combination of instant treatments. Number one, nitroglycerin. Now, this is your quick relief. Actually, it dilates your blood vessels, improving the blood flow to your heart and reducing its workload. It's usually given as a spray or a tablet under your tongue for rapid absorption. Number two is aspirin. This is your first line of defense against clotting. It actually stops platelets from sticking together, which can reduce the size of the existing clot and preventing it from growing. And they usually give you a hefty dose to chew or swallow right away. Number three is clot busting drugs. Now, if there's clear evidence of a clot blocking your coronary artery, they might use these heavy hitters. Now, these drugs dissolve clot that's blocking blood flow to your heart muscle. They're given IV and can be real lifesavers. Number four is heparin. Now, this is another anticoagulant or blood thinners. It actually prevents new clots from forming and stop existing one from getting bigger. And it's usually given intravenously in the hospital. Now, number five is actually magnesium sulfate. Now, it's not really as common, but it might be used if you're experiencing severe arrhythmia or known as irregular heartbeat. So during your heart attack, it actually helps stable your heart's electrical activity. And number six is epinephrine injection. This is in severe cardiac situation, especially during a cardiac arrest. And epinephrine is actually administered intramuscularly given in the deltoid muscle of the upper arm, or less commonly in the pectoral muscle. Prevention is the best medicine. Now, let's talk about what really matters, preventing this from happening in the first place. Here's what you need to do. See, the common intervention is regular exercise, eat right, manage stress, regular checkups, and some doctors think you are medically deficient. But let's break it down. Let's say you already know for a fact you have a high CAC score, and or you got scanned using CCTA and you did confirm high calcification and soft plaque possibly. So a heart attack could be a possibility. So what is your next step and or how to prevent a heart attack? As stents and bypasses shouldn't be your go-to solution or your only hope. They're band-aids, not cures. Your first line of defense is lifestyle changes, nutrition, and understanding your body. Don't wait for a surgeon to crack open your chest. Remember, prevention is always better than intervention. Your best stent is the one you never need. So how I survived my second heart attack. See, my journey with fasting and prevention. See, my second heart attack happened due to stent damage. I'm sharing a remarkable story that happened to me, and it's not just another influencer's tale. This is real life, potentially life-saving account of surviving a second heart attack and the unexpected role of fasting. This information could be a game changer for your heart health. It was a typical afternoon. I just broken an 18-hour fast with a juicy, rare ribeye steak. Sounds good, right? But then massive chest pain hits, accompanied by severe acid reflux, something I'd never experienced before. And this pain lasted 2 hours, subsided, and then returned with a vengeance 5 hours later during my second meal. As I've been through this before, I recognize the signs: intense chest pain, upper back pain, shivering and sweating. Acid reflux was something new to me. I knew I was likely experiencing a second heart attack. Quick thinking, I took nitroglycerin, cayenne, chewed some raw garlic, and pain was eliminated. So here's where it gets very interesting. I noticed a pattern. The pain came after eating. I made the bold decision to actually fast for 72 hours straight. Surprisingly, during this extended fast, the pain completely disappeared. I felt great. I was able to exercise and carry out normal working activities. So the science behind fasting and your heart reduce cardiac workload. See, fasting gives your heart a break from the demands of digestion. Ketosis benefits, as extended fasting switches your body to ketones for energy, potentially improving heart function and reducing inflammation. Improved metabolic markers. See, fasting can lower blood sugar and insulin levels, reducing inflammation and atherosclerosis risk. Nitric oxide boost. See, fasting may actually enhance nitric oxide production, improving blood flow and reducing angina symptoms. So after 72 hours, I broke the fast with a hearty meal. Initially, felt great, was roughly around 7 p.m. in the evening, but at 2:30 a.m. I was jolted awake by my Oura Ring alarm. Massive acid reflux pain returned, profuse sweating, heart rate skyrocketed to 130 beats per minute. This time I was undeniably a full-blown heart attack. So emergency services were called and on-scene treatment included 5 epinephrine injections. Here are key takeaways: prevention and symptoms management. Now, nitrates are part of my daily intake for the past 10 years. They are a patent designed to enable nitrate for 8 hours and the release of nitric oxide per demand, as they can provide a vasodilation and prevent further damage, and increases EPCs, that are cells that can develop in the areas of damaged blood vessels, and help repair them. Prolonged fasting will help in delaying or preventing symptoms in some cases, because prolonged fasting is the key to reduce inflammation, improved insulin sensitivity, cellular repair and autophagy, and blood pressure regulation. Could it actually repair damaged arteries? Possibly, with the right supplementation. So recognize the signs, people. Chest pain, acid reflux, sweating, and rapid heart rate can all be indicators of a heart attack. And in some individuals, jaw locking and tense shoulders. Do seek immediate help. If you suspect a heart attack, call emergency services immediately. But let's put all the stuff on the side. You want to start your protocol ASAP after finding out your CAC score. Treatment should include the following: Cavadix twice a day as enema, nitrate supplement every morning to vasodilate your arteries, EDTA 1200 milligrams every night should be cycled, or IV chelation therapy, Narokinase 12,000 FU, serapeptase 500,000 SPU with food, vitamin K2 500 micrograms up to 10,000 micrograms per dose with food, vitamin D3 1000 IU per 25 pound of body weight, magnesium ionic chloride 200 milligrams every 4 hours with taurine of 3000 milligrams per dose. So this is your protocol to follow, but while you are following this protocol, make sure your nitrate supplement, patent design, should be consumed at all times to prevent any further damage and constantly vasodilating your arteries. In addition, not any type of nitrate supplement will work, especially if you are over the age of 40 and or already have heart disease. Citrulline, L-arginine, or beetroot that is not extracted properly will not convert to nitric oxide. So guys, if you know someone dealing with heart disease, be a hero and share this video. You could literally change their life. And if my videos have made a difference for you in even the tiniest way, consider throwing a buck or two my way. That will help me keep making awesome videos and doing more self-testing. Cheers to better health.